So this time last year, we were on the brink of perhaps the world's strictest lockdown. And one of the biggest shocks was not being able to exercise outdoors. That restriction, of course, eventually eased, but it was a reminder for many of how crucial physical activity is for our health, both physical and mental health. So are we a year on, a healthier nation? Certainly the early morning cyclists and joggers were out in full force this morning on Johannesburg's roads. I'm joined now by Vicki Lambert, Director at the Centre for Health through Physical Activity, Lifestyle and Sport at UCT's Sports Science Institute. Good evening. Thank you so much for joining us. You know, that outdoor exercise ban, was the impact worse on our waistlines or on our mental state?
Sally, it's a great question, and I wish I had an easy answer. Most countries don't do regular surveillance of physical activity as a risk factor for non-communicable diseases, and they should, in fact, because it's one of the fourth or fifth most common risk factors globally. What we do know in countries where this has been measured is that during hard lockdown, physical activity certainly went down, and the groups that were most affected were the vulnerable, the urban people living in socioeconomically disadvantaged communities. In South Africa, many people have to be physically active to get to and from places or for their occupation. So when in hard lockdown, obviously that was affected. The sense is that physical activity levels went down, certainly in people who were previously active. But what we have noticed, or what is noted, is that there's a pushback from civil society. So we worked with the Ministerial Advisory Committee in helping them to formulate guidelines. Didn't always agree, but we helped them to formulate guidelines so that we could try to encourage population-based physical activity and recognizing social distancing and mask wearing. But importantly, it was in cities like in Kenya, Nairobi, where the people literally took back the streets and actually, mobilized to be physically active. And, for many countries, they don't have a national physical activity plan. Only 4 countries in Africa do. And yet this is the first time that there was a regulation around physical activity, and it was to limit it, which was really fascinating. So it was a foot in the door. We could actually start to mobilize.
Yes, and it's interesting because in many ways what it did, I suppose, was create like a national study group to see what happens when people cannot get outside to exercise. And we know that there were parts of society that stuck very carefully, especially in those first 3 weeks. But there were other parts of society where people live in tiny homes where they simply had to get outside. There was nowhere they could stay inside. So it was a bit of a difficult one to assess. But certainly for those people who were able to stick to that ban, what did you learn?
I think a lot of things. One is that certainly, again, I'm looking at the global picture. There's certainly evidence that physical activity did decrease in most countries. There are emerging trends. There was more online activity. There was actually more family-based activity as lockdowns were eased, and obviously more outdoor physical activity. And there were initiatives, for example, in the Western Cape, there's a large public health initiative called Western Cape on Wellness. And in fact, membership increased over this time. It's run by the Western Cape Department of Health. But a lot of that membership and a lot of those activities were online. And I think the key thing that I picked up is that it was civil society, and that we recognize, and the UN and the WHO recognize, that physical activity is a basic human right. And we know that physical activity is the very thing that mitigates those conditions that make people susceptible to COVID. And in fact, there are studies which show that if people are active, they're less likely to be hospitalized for COVID. And so, this is really the starting point, I think, of recognizing the importance of physical activity for health and retaining it.
So, Professor, a year on, are we a healthier nation? And I ask that not thinking about COVID itself and how it's impacted our health, but just generally, we know that, for example, obesity is a serious risk factor. So we've learned a lot of, certain health lessons have been reinforced. But on the other hand, crucial health checks have been neglected. So all told, are we healthier than we were a year ago as a nation?
I think you've highlighted the very problem, that there are swings and roundabouts where you have an urgent pandemic, an infectious pandemic that actually has in some cases sort of displaced routine care, for example, in certain types of treatments, including TB and cancers and what have you. What I think has happened is that we have created an awareness of the link between infectious and chronic disease. The fact that, again, the people at most at risk for COVID are those that also suffer from non-communicable chronic diseases, and the treatment for those relate to access, affordable access to healthy food and safe access to enjoyable physical activity. And we know that any activity protects. Any activity is better than nothing.
Absolutely. So this weekend we better get out there, enjoy the early autumn sunshine. Thank you very much, Professor Vicki Lambert, Director at the Centre for Health through Physical Activity, Lifestyle and Sport.